Every year, millions of older adults walk into clinics and hospitals believing they are doing the right thing. They schedule tests, scans, and screenings because they want to stay healthy, stay independent, and protect their future. It feels responsible. It feels smart. It feels safe. But there is a side of modern medicine that almost no one talks about, especially when it comes to people over the age of 70. A side that quietly causes fear, unnecessary treatments, and in some cases, permanent harm. Welcome to Thrive and Shine, a channel dedicated to helping you build true inner strength and natural outer glow. Here we focus on simple exercises, healthy daily habits, and trusted natural remedies that support your body from the inside out. No shortcuts, no extremes, just gentle healing, growing confidence, and lasting wellness. If you want to feel energized, age gracefully, and shine from within every day, you're in the right place. Subscribe to Thrive and Shine, and let's grow healthier and brighter together. What if some of the routine checkups you've been told are essential are actually increasing your risk instead of reducing it? What if the very tests meant to protect you are the ones pushing you toward procedures you never needed, medications you never should have taken, and complications that change your life forever? New research has revealed something deeply unsettling. A significant portion of medical testing in seniors does not lead to better health outcomes. Instead, it leads to overdiagnosis, overtreatment, and a cascade of follow-up procedures that can be far more dangerous than the original concern. Even more alarming is that most people over 70 have no idea this is happening to them. They trust the system, they trust the process, and they assume more testing always means better care. But the science tells a very different story. Today, we're pulling back the curtain. We're talking about 5 common health checkups that are often pushed on seniors and why, after 70, they can do more harm than good. This is not about ignoring your health or avoiding doctors. It's about understanding when medicine helps and when it quietly crosses the line. Some of what you're about to hear may surprise you. One of the tests on this list is linked to a measurable increase in cancer risk. Another regularly sends healthy seniors down a path toward invasive surgery they never needed. And one, in particular, has become so normalized that most people never stop to question it, even though experts are increasingly raising serious concerns. This isn't fear-based talk. This is about informed decisions, grounded in real-world outcomes and long-term data, and by the end of this, you'll understand why asking the right questions can sometimes be more powerful than saying yes to every test. Let's start with something that sounds harmless, quick, and almost reassuring. Many older adults are told that checking bone strength is a smart preventive. STEP, a simple scan, no needles, no pain, just a number that tells you whether your bones are strong or fragile. On the surface, it sounds like common sense. But after 70, this type of testing often creates more anxiety than benefit. Bone density naturally decreases with age. This happens to everyone. It is part of the normal aging process, just like changes in vision or skin texture. Yet when seniors undergo bone scans, the results almost always come back labeled as low or borderline. That label alone is often enough to trigger medication prescriptions. Even when the actual risk of fracture is low, the problem is not the skin itself. The problem is what happens next. Many seniors are quickly placed on bone-strengthening drugs that come with serious side effects, digestive irritation, severe acid reflux, jaw pain, and rare but devastating bone complications are not uncommon. And when researchers followed older adults taking these medications for mild bone loss, the actual reduction in fracture risk was minimal. In some cases, nearly negligible. What made the biggest difference wasn't medication at all. It was strength training, balance exercises, adequate vitamin D, and proper nutrition. These lifestyle changes reduced falls and fractures far more effectively, without the risks associated with long-term drug use. There was a woman in her mid-70s who stayed active, walked daily, and had never broken a bone. After a routine scan labeled her bone density as reduced, she was started on medication immediately. Within months, She developed intense jaw pain and digestive problems that affected her ability to eat and enjoy life. When the medication was stopped and replaced with targeted movement, strength work, and nutritional support, her quality of life returned. The skin number never changed dramatically, but her confidence, balance, and mobility did. For many seniors who are not falling and not fracturing, focusing on movement and muscle strength is far more good than chasing numbers on it. Report. Another test that causes quiet harm often starts with fear. Memory changes are terrifying. Forgetting names, misplacing items, or feeling slower mentally can trigger immediate concern about serious brain disease. In response, doctors frequently order detailed brain scans to check everything. The intention is reassurance, but the outcome is often the opposite. In adults over 70, brain scans almost always show age-related changes, small spots, mild shrinkage, and structural differences that are completely normal later in life. The problem is that once these changes are seen, they are often framed as abnormalities rather than expected findings. That framing can lead to panic, additional testing, and in some cases, invasive procedures that do nothing to improve memory. Large reviews of brain scans in older adults with mild memory concerns have shown that the vast majority of findings are not linked to treatable conditions. Yet many patients are told something is wrong without context. Anxiety increases, confidence drops, independence begins to slip, not because of disease, but because of fear. There was a retired professional in his 70s who came in worried about occasional forgetfulness. A scan revealed age-related changes, and suddenly his entire self-image shifted. He stopped driving. He withdrew socially. His anxiety skyrocketed. Later, standard cognitive testing showed his memory was well within normal limits for his age. What he needed was reassurance, better sleep, hydration, and mental stimulation, not a scan that changed how he saw himself. For mild memory concerns without alarming neurological symptoms, simple cognitive assessments and lifestyle adjustments are often the best first step. They are safer, clearer, and far less likely to create unnecessary distress. Then there's a test that feels almost automatic for many older adults. Feeling tired. Slowing down a bit, getting winded on hills. These are common experiences with aging, yet they often trigger heart testing designed to detect serious disease. One of the most frequently ordered is a test that stresses the heart to look for blockages. The problem is accuracy. In people over 70, these tests frequently suggest problems that aren't truly there. False alarms are common, and once a test suggests an issue, it opens the door to more invasive procedures. Catheters, contrast dyes, stents, even surgery. Studies have shown that many heart procedures performed after these tests do not improve lifespan or quality of life in older adults without clear symptoms. What they do increase is the risk of complications, including bleeding, kidney injury, and prolonged hospital stays. There was a man in his mid-70s who stayed active and enjoyed daily walks. After mentioning mild fatigue, he was sent for testing just to be safe. One unclear result led to another test, then another. Eventually, a minor narrowing was treated aggressively. The procedure itself caused kidney complications that required hospitalization. The original fatigue never improved because it was never a heart issue to begin with. For seniors without classic heart symptoms, simpler evaluations are often safer and more appropriate. Sometimes the best care is careful observation rather than aggressive investigation. One test on this list surprises almost everyone. It's widely promoted as life-saving, routine, and essential. But after a certain age, the balance between benefit and harm shifts dramatically. The preparation alone can be brutal. Powerful laxatives cause dehydration, dizziness, and electrolyte imbalances. Sedation carries added risks for brain health in older adults, and the procedure itself can result in bleeding or tearing that requires hospitalization. Large population studies have shown that in people over 75, the number of serious complications far outweighs the number of lives saved. Through routine screening, many growths found are slow-growing and would never cause problems during a person's lifetime. Yet once discovered, they are often removed, triggering risks that didn't need to exist. There was a woman in her early 70s, active and symptom-free, who agreed to screening simply because it was recommended. A small growth was removed. Hours later, she was back in the hospital with severe pain. A complication led to days of recovery and months of lingering weakness. When her records were reviewed, there had been no strong reason for the procedure in the first place. For many seniors, non-invasive alternatives can provide useful information with far less risk. And in some cases, stopping routine screening altogether is the safest choice. Finally, we come to the most overused and misunderstood test of all. It's often marketed as a comprehensive way to check everything, a scan that promises early detection and peace of mind. But in reality, it delivers something very different. These scans expose the body to significant radiation. In older adults, they frequently detect harmless findings that trigger a chain reaction of follow-ups. More scans, biopsies, specialist visits, sleepless nights. There is no solid evidence that scanning the entire body without symptoms improves survival. What the evidence does show is an increased risk of radiation-related harm and unnecessary procedures. One active senior participated in a high-end screening program and was told a tiny spot had been found. What followed was months of testing, a biopsy, and a serious complication that required hospitalization. The finding was benign. The harm was real. Medical experts are clear on this point. Whole-body scanning without symptoms is not preventive care. It is fishing in dangerous waters. Real prevention doesn't come from fear-driven testing. It comes from movement, nourishment, rest, connection, and thoughtful medical decisions. Modern medicine is powerful, but more is not always better. Especially after 70, every test should be weighed carefully. What will this change? What happens if something unclear is found? Will the next step help or hurt? Sometimes the most courageous choice is to pause, ask questions, and choose wisely. If you or someone you love has experienced unnecessary testing or complications that could have been avoided, you're not alone. These stories are more common than people realize, and sharing them helps others make better decisions. Health is not about chasing every test. It's about protecting your quality of life, your independence, and your peace of mind. And sometimes, doing less truly means living more. Remember, real change comes from small, healthy choices repeated every day. If today's video helped even a little, imagine what staying connected can do over time. Subscribe to Thrive and Shine for simple exercises, healthy habits, and natural remedies to support your inner and outer glow. If you found value here, like and share this video with someone who could benefit. Thanks for being part of our community. Keep caring for yourself, keep moving forward, and keep shining.